Welcome to the platform Swiss Liver Patients Association, Swiss HIPAA. Today with the interview by Professor Andrea de Gottardi, Head of Gastroenterology and Hepatology at the Ticino Cantonal Hospitals, about the topic Wilson's disease or Cooper storage disease. Welcome, Professor de Gottardi.
Thank you very much, Karina, for the invitation. I'm happy to be here.
What is Wilson's disease?
Wilson's disease is a genetic disease. This means that your DNA develops a defect. This defect comes from your parents sometimes, but sometimes generates spontaneously, so that you cannot anticipate necessarily the presence of this disease. This is a disease that relates to the liver, but not only to the liver. The liver is the center of the disease, but it can also be associated with neurological diseases.
What are the symptoms?
This is a very interesting aspect of this disease because very frequently you don't have any symptoms. Increased liver function tests, but nothing else. And the symptoms may go from nothing to acute liver failure. You can have patients between age 15 and 50. This is a disease which is rather seldom in the older age, and it can manifest with acute liver failure, with the patient being yellow, so with jaundice, with hepatic encephalopathy, which is confusion, with the accumulation of water in the belly, which is ascites. And it can also be associated with cirrhosis, which is an advanced form of liver disease. So Wilson can develop very acutely or progressively over years and years. And interestingly, this is a problem related to the transport of copper. And copper is a metal that we need for several functions, and this is good. But in Wilson's disease, we have too much copper, not only in the liver, but sometimes also in other locations in our body. And sometimes patients with liver disease come to medical attention with neurological problems. For example, gait disturbances, or for example, psychiatric diseases. And this can be related to the accumulation of copper.
How is Wilson's disease diagnosed?
Several possibilities to diagnose this disease. Very frequently, we receive patients with suspicion of of Wilson's disease because they have elevated liver function tests, together with a change in some markers, for example, ceruloplasmin. Ceruloplasmin is a protein which is involved in the transport of copper, and we can easily measure that with a blood examination. We can also measure the elimination of copper in 24-hour urine, and this is a very clear diagnosis of Wilson's disease. We can diagnose it by doing a liver biopsy, and we observe under the microscope the biopsy, and we see whether or not liver cells are suffering, whether or not there is fat accumulation, whether or not there is copper accumulation, and so on. And sometimes when there is a neurological disease, we can also observe in the magnetic resonance of the brain some changes that are typical for Wilson's disease.
How is Wilson's disease treated?
Treatment depends basically on the stage of the disease. If you have only some increased transaminases and your liver function is fine, then adding some zinc tablets to your diet may be sufficient to completely correct the accumulation of copper and to avoid any progression of the disease. There are, however, other situations where the disease is more important. And in that cases, we have special substances called chelators. And chelators are a kind of glue around copper, and this glue is taking copper and eliminates it through the urines. These drugs are, for example, penicillamine or trientine, and these drugs are commercially available and should be taken for a long time, and usually all lifelong. There are situations, in particular, when Wilson's disease occurs and manifests as acute liver failure, when there is no other choice than liver transplantation, because drugs are in these circumstances not enough to correct the metabolic problem of these patients.
How common is Wilson's disease?
This is a rare disease, especially in young patients. As I mentioned, so between the age 15 and 50, we can observe and diagnose this disease. This is very seldom in the older age population, and it is considered a rare disease, and we see a few cases per year only.
Who is at risk?
This is a very difficult question because we don't know. There are situations where family members have Wilson's disease, and this is known. And in that case, Wilson's disease should be looked for in the other members of the family. But quite frequently, these mutations, so these changes, these errors in the DNA replication from one generation to the other, and occur without any rule. So these are casualties, and for this reason, it is difficult to foresee which patients are at risk of developing Wilson's disease in also its neurological form.
Do you have some more information about Wilson's disease or recommendations?
Well, maybe only a recommendation. Wilson's disease is difficult to diagnose. And once you have the diagnosis, you can do something. And for this reason, it is important not to miss the diagnosis. So if you are a patient and you know that your transaminases or your liver function tests are not really normal, you should go to your GP or to your specialist for liver diseases and ask for investigations. It is really cheap to investigate Wilson's disease and to exclude Wilson's disease. And this has big consequences because this is basically treatable disease. So my recommendation is just not to ignore the fact that if you have an elevation of liver function test, you should investigate it.
Thank you very much, Professor de Gottardi, for your understandable and helpful interview, which can be an additional important source of information for patients. Thank you very much.
Thank you very much also to you. Goodbye.